In January, I tore my rotator cuff, and that led to having to have surgery. If you have a severely torn or fairly large tear in a rotator cuff, number one, you cannot sleep laying down because as the shoulder drops, then you get pain. So the first thing that you have is you're not getting a good night's sleep. The second thing you can't do is you can't raise your arm at all. You just can't raise it. So you have all those things, those activities that you would normally do that you can't do. Very difficult to cook, very difficult to chop, very difficult to do all those household chores that you're used to doing. So it's quite debilitating. It isn't a choice of am I going to fix this or not. It's a choice of who's going to fix it for me. You know you're going to have it repaired. Your question is, what kind of a repair am I going to have done? Am I going to have a traditional repair done where they're going to slice the arm and go in? Am I going to have just the minor repair done? Or am I going to go all the way and give it a shot for stem cells? For those of us that have always been active and have a core of exercises that we do every day, once you can't do that core of exercises, then you think to yourself, I've really got to get this taken care of. I started looking at who are the organizations that are actually doing stem cells, because all the latest information, all the latest success seems to be with stem cells and regeneration. I'm also very old, so I know about stem cells, having researched it. You can't take stem cells from an old body and put them into a surgical spot because they're not going to work. So you don't want to see someone who's going to tell you, I'm going to harvest your stem cells. Right away you know this is not something that is going to work for me. When you do your research, you have to always make sure that the physicians you're dealing with have no record of any malpractice claims. That's primary. And we have these men here who've been in practice for years and years and years, and they have no history of any malpractice claims. That's incredibly important, I think. Whenever you walk into a new medical facility or a new medical office, you're always a little apprehensive, but the very atmosphere in this office is so low key. There's none of that sense of we're in a hurry, we got to get through this, I've got 6 people waiting. They're just nowhere do you ever see any of that. First you meet with Dr. Dean, and he explains every single thing, that all your options, exactly what you have available to you. Takes as much time with you as you possibly could need. And then you also meet with your surgeon. As I said, my doctor was an incredibly nice young man. He took hours with me explaining everything that was going to go on. And then you make your arrangements and you go into the conference room, and again, if you have any questions, you can always ask them. They have an incredibly nice young woman, Regina, and Regina calls you and reminds you of your appointment and says, how are you doing, and do you need anything? I have never seen such incredibly inclusive pre-surgery instructions. They're not only saying don't take baby aspirin, don't take your chemical medications, they're also saying don't take this herb and garlic and different herbs so many weeks before the surgery. So they have a much better understanding of the fact that this is a complete and total person who does more than take medications. There's a very good atmosphere. The surgery center is immaculate. And everybody there was very good. You go in, you meet with the anesthesiologist, the whole thing is done very quickly, and then when you come out, you put on this marvelous little sling, which you'll wear for 6 weeks, and then you're off into your recovery. The surgeon then came out, Dr. Malam, and he showed me pictures and gave me pictures of exactly what he did to my shoulder. So I have pictures of, this was my shoulder before. They put 4 little teeny incisions. They're not even that big. Little teeny things in here. And going down in those little teeny incisions, they clean out all the bone spurs, they scrape it all up, they sew that back together, your little rotator cuff, all that muscle all back together, and he does it in an hour, and you're off. It's just absolutely amazing. Then the next day you come in and you get your stem cell shot, and then you're healing. The reason that you need the stem cell shot is because, as I understand it, that you don't get very good circulation to the bone. And because of the poor circulation, that's why you have the low success rate. But with the stem cell shot, that starts it all into healing and increases the blood flow too. So you've got all of that going on also. So I would say that from every indication we've got, we've done it. What does it mean to me? It means to me a whole lot of freedom. What I'm really, really looking forward to is getting in a swimming pool and doing the crawl. I've not been able to do a really good crawl for probably 10 years, and I just can't wait to get in there and do it. I think if anyone is has any problem with their knees, their hips, or their shoulders, that they absolutely should come to this practice, because they're going to find people who will spend time with them. And I think the biggest thing in going into any surgery is dealing with someone who's just trying to rush you through, doesn't want to answer your questions, and where the practice is just too large, where you call and nobody calls you back for 2 days. The beauty of this is that you will not be by yourself out there. The other thing is that even within your physical therapy, and my surgeon told me to tell the physical therapist, if you have any questions about anything before you do it, call me. I'll always take your calls. Tell me why you're calling, and I'll discuss with you what you're going to do. And I know he will. And I don't know of many surgeons who are going to do that for someone that they've already finished with. So no, I think that this is an amazing, amazing group. And I would recommend it to anyone. Particularly, I would say the more apprehensive you are, the more you need that kind of care, the more you need that kind of accessibility with your questions.